Hi, I'm Dr. Joe Maccarone, and I'm here to talk to you today about some surgical questions that my patients frequently come up with, and in general, just the discussion that we like to have before planning surgery and what happens after. In the pre-op period, I like to give the patient all the information about what exactly it is that we're going to do. It's not just going and saying, I'm going to do this to you. We have a consent process. Once we have informed consent from our patients, based on their medical history or conditions, I order lab tests. I could order imaging or blood studies, and these are all done preoperatively so that we can see if they're good candidates for anesthesia and surgery or if they need any other evaluation. The night before surgery, we tell our patients nothing to eat or drink after midnight. They are allowed the morning of surgery to take blood pressure medications. Our anesthesia people will call them the night before and tell them when to show up. So you'll know when you need to show up for surgery. And usually that's about 2 hours before the scheduled start time. That morning, you'll come to the hospital, you'll have an intravenous, you'll meet anesthesia, and you'll see me again, and we'll review that consent process again. And this is a safety measure for all our patients to make sure that we know exactly what we're doing and they get handed off appropriately. Then they have surgery. And one of the most common questions that I hear is, will I be admitted to the hospital for an overnight stay? And we typically say, again, based on surgery, whether this is outpatient, in which case you would not stay, or a reconstructive or vaginal surgery where you might stay overnight or a couple of days. These are again based on the patient's health and the type of procedure that we do, and we discuss those individually. Another common question is, will I have pain? And we try to reassure the patient that although every surgery causes some pain, we're going to medicate you appropriately based on your needs. If it's an outpatient procedure, the patients will get pain medicine to go home with if they need it. If it's an overnight stay or longer in a hospital, they get intravenous or oral pain medicine depending on how they're doing. But we make sure that they're comfortable and the pain does go away over time. They also like to know about, will I have bleeding? And again, depending on the route of the surgery, whether it's abdominal or vaginal, you might have some bleeding. Very commonly with vaginal surgery, we'll place a pack in the vagina. That pack is gauze that comes out the next day. And then we tell the woman that the next day or for weeks following that, they might have a little bit of a discharge or drainage or even spotting. That would go away over time. And they're instructed to call us if the bleeding is heavier than a menstrual period. Another very common and necessary thing to address is what's your activity level supposed to be? A lot of people think that they should not move after surgery, and we encourage our patients immediately to get out of bed. We tell them they can go up and down stairs. They can ride in a car. After 2 weeks, we allow them to drive a car. We don't allow anything vaginally for about 4 weeks, or until they've seen me for a checkup, which typically our follow-up time is about 4 weeks. That includes sexual activity, tampons, or douches. We don't allow any of that for 4 weeks. Stairs, no limit. Work's always is an issue because people do lots of different jobs. If the patient's job involves heavy lifting, which is 10 pounds or greater, or a lot of straining or pushing or pulling, we feel that might compromise our repair. And so we instruct them to avoid that for 12 weeks. But if a person says that they can go back to work and has a desk job or a sedentary job, they can return to work as soon as they can sit comfortably and function comfortably at their occupation. As far as bathing, another important activity, our patients can immediately shower. If they have a catheter, which is yet another question, then they would take a shower. If they do not have a catheter, they could take a bath. As far as catheters, will I go home with a catheter? That depends on the type of surgery and your response to the surgery. Some women have a minimally invasive sling, for example, and they can't urinate afterwards, and they would go home with a catheter, and they would see me in the office in a few days for me to try to get the catheter out. If they have an abdominal catheter called a suprapubic catheter, my nurse would call them 3 times a week, and we give them a voiding diary to record their voids and residuals, which they're measuring with a hat in the toilet and a graduated cylinder. And the average length of time that a catheter is in is 1 week. I always impress on the patients that that's an average, that's not them specifically, but that's an average that we found when we looked at it. What about bowels? Bowels are really, really important. I try to get our patients preoperatively to get their bowels in a good habit, to make it predictable and easy, and so they avoid straining at bowels, because that would be considered heavy lifting. And my discharge instructions that I give them do include a whole paragraph on laxation, and that's very important, and our patients we reinforce that with our patients, that they need to really work on their bowels. Medications, when do they start their medications up again? Some are on aspirin, some are on blood thinners. Typically, I tell them the next day. It's individualized, of course, but in general, we want them to restart all their normal medications the very next day, except for anything that would go in the vagina, like an estrogen cream. We would hold off on that. What about the post-op appointment? I mentioned typically that's 4 weeks. That's my first appointment typically with the patient. We do an exam. I tell them what the restrictions are, and I ask them to come back prior to 12 weeks for a follow-up visit, because we want to see how they're doing, we want to see how our repair looks, and by that time, all our suture lines should be healed, and we can release them with no restrictions. And most importantly, as part of this whole surgical process, my patients do receive typed written instructions that have our office contact number on them. They can reach us at any time for any issues. So please be sure that you feel that you can ask your doctor any questions and that you have a good contact number so that you can reach them if you have any of those issues that we talked about. Thank you.